Assalamu alaikum. The topic of our discussion today is the arterial blood gases. First we will recognize the normal and abnormal values for pH, partial pressure of oxygen, carbon dioxide, and the arterial saturation of oxygen and bicarbonate levels, and then relate the pH scale to acidosis and alkalosis, and then discuss and then we will interpret the basic arterial blood gas values and relate these to patient conditions. What is the indication for this test of arterial blood gases? The indications include: number one is inadequate ventilation, which can be in case of not awake or unconsciousness or breathing too fast, that is hyperventilation. Main concern about respiratory muscle fatigue. And then the second indication is the concern about oxygenation, which cannot be addressed with pulse oximetry. For example, in case of carbon monoxide poisoning, there is carboxyhemoglobinemia and methemoglobinemia in case of benzocaine intoxication. And then the third indication, and which is the most important one, which we are going to discuss today, is concerned about acid-base balance. For example, like in sepsis, diabetic ketoacidosis, and multiple drug overdoses, or in case of chronic carbon dioxide retention or respiratory failure. And then there are some miscellaneous causes like after chest intubation, and to monitor the ventilator settings and pre-op baselines. What is the physiological basis of arterial blood gases? As you can see here in the diagram, the ventilation or the alveolar ventilation breathing occurs when oxygen comes inside and carbon dioxide goes out of the lungs. Okay, oxygen is coming inside the lungs and carbon dioxide is going out of the lungs to the environment. When this oxygen is absorbed through the bloodstream from alveolus into the blood, this is known as perfusion. And hemoglobin molecules are the basically carriers which carry oxygen to the tissues. Here you can see a little bit of detail of the previous one, that in alveoli oxygen is coming from the environment. This oxygen is being taken up by red blood cell which has hemoglobin molecules. Okay, this is hemoglobin molecule which is taking up oxygen, and then this red blood cell along with this oxygen carried by hemoglobin is going to the tissues, where this oxygen is released into the tissue cells and carbon dioxide is taken up in place of this oxygen. So this is the role of red blood cells. And the oxygen carrying capacity of red blood cell is due to hemoglobin, which has 4 binding sites, 1, 2, 3 and 4, and it carries oxygen. So here you can see that when hemoglobin combines with 4 oxygen molecules, oxyhemoglobin is formed. And hemoglobin binding sites, they get more and more oxygen binding capacity, which is oxygen affinity is increased when oxygen is bind. Here you can see that the iron containing binding site of this hemoglobin molecule, when it attaches oxygen, its affinity increases. Okay, so oxygen binding site include when all of the 4 sites are occupied, the hemoglobin molecule cannot hold any more oxygen, and the molecules other than oxygen can attach to the oxygen binding sites, as we saw from the example before, like carbon monoxide or methemoglobin. And then if enough hemoglobin sites are occupied with molecules other than oxygen, severe tissue hypoxia can result, and hypoxia can also occur even in the presence of 100% oxygen. That is, there is a lot of oxygen present, however this cannot be taken up by hemoglobin because hemoglobin is already bound to certain other molecules. So this can be a life-threatening condition because this oxygen cannot be delivered to the tissues. So what happens in carboxyhemoglobinemia? Carboxyhemoglobin is a hemoglobin molecule which has carbon monoxide attached where oxygen should be. And exposure to car exhaust or other chemicals can cause carbon monoxide poisoning, which comes attached to hemoglobin binding site instead of oxygen and thus compete with oxygen for limited number of binding sites. And so the blood will exhibit a cherry red color. And what happens in methemoglobin? Methemoglobin is produced when exposed to certain poisons or due to a genetic condition which affect hemoglobin molecule. In this case, hemoglobin is attached or saturated with methemoglobin and competes with oxygen for hemoglobin binding sites. The methemoglobin changes blood to a brownish color, and in case of oxygen combination with hemoglobin, what happens is that carbon dioxide affinity for hemoglobin is much less than oxygen affinity. So when carbon dioxide and oxygen both are available, hemoglobin will combine more readily with oxygen, that is, it will prefer to bind oxygen instead of carbon dioxide. Hence, in oxygen-rich environment like that in case of alveoli, hemoglobin chooses oxygen to carry with itself, and this oxygenated blood travels through the body. And now we come to the acid-base balance. Understanding the cause of an acid-base balance is a key to treating it. The respiratory component of acid-base balance affects the pH within minutes. The metabolic component of acid-base balance can take days to affect pH. A brief recall of the buffer systems. As you can see, carbonic acid bicarbonate buffer system, we talked before that it depends on two things. One is the normal functioning of lungs and normal carbon dioxide going out and coming inside, and the other thing which it depends on was bicarbonate reserve, that is enough sodium bicarbonate is present which can deliver the bicarbonate ion when needed within the extracellular fluid. So the carbon dioxide, what is its role? What is the role of this carbon dioxide? This combines with water forming carbonic acid, and carbon dioxide is an acid when dissolved in water, and carbon dioxide is also a product of metabolism. As long as the cells are functioning, they are producing carbon dioxide. And where does this bicarbonate comes from? The bicarbonate, it increases in response to increased carbon dioxide, and the metabolic change takes a few days to affect the pH. Now the basic components of ABG include four things. Number one is pH, number two is PaCO2, number three is bicarbonate, and number four is PaO2, which means partial pressure of oxygen in arterial blood. This is partial pressure of carbon dioxide in arterial blood. So the normal pH scale ranges from 1 to 14, where 7 is neutral and low pH is acidic, and above 7 is alkaline. The pH of blood is slightly alkaline, which is 7.35 to 7.45, and this is now normal blood pH, which is maintained by the balance of carbonic acid and bicarbonate ions. Less than below is acidosis, and above than this is alkalosis. And what is partial pressure of carbon dioxide in arterial blood? Carbon dioxide, like oxygen, some of it is dissolved directly into the plasma. The partial pressure of carbon dioxide is the measurement of the partial pressure of carbon dioxide dissolved in plasma and is measured in millimeter of mercury. The rest is found in RBCs in hemoglobin molecule. The partial pressure of oxygen. About 3% of the body's oxygen is dissolved in plasma, and arterial oxygen is measurement of the partial pressure of oxygen dissolved in plasma only. It is measured in millimeter of mercury. PaO2 does not tell us about the total body oxygen. However, it does indicate how much oxygen was available in the alveoli to be dissolved into the blood. So, because this PaO2 does not give about complete body oxygen content, so that's why we need saturation of oxygen, SaO2. This means that remainder of the body's oxygen carried attached to hemoglobin molecule. SaO2 or oxygen saturation is the measurement of degree of oxygen bound to hemoglobin. It is expressed as percentage. So here you can see the ventilation is the key responsibility of the lungs, which control the carbon dioxide levels. So the more the carbon dioxide level in the body is directly related to the ventilation. High carbon dioxide levels uh, will lead to hypoventilation, and low carbon dioxide will lead to hyperventilation. So here we can see the effects of hypo and hyperventilation on the arterial blood gases. In case of hypoventilation in arterial blood, there will be retention of more carbon dioxide, hence PCO2 will increase, and since carbon dioxide is acidic, so hydrogen ion concentration will also increase, or in the other words pH will fall and oxygen concentration will fall, and the chemoreceptors will detect and respond, and the respiratory control central will then work to bring the ventilation to normal, and hyperventilation will occur as a negative feedback. In case of hyperventilation in arterial blood, carbon dioxide concentration will fall as more and more carbon dioxide is being released into the environment, and the pH will increase because of decrease in hydrogen ion concentration, and there will be increased oxygen concentration in the blood. So this will cause the chemoreceptors to detect and respond, and the respiratory center will slow down and cause a decrease in ventilation, which will be a negative feedback to the fall of carbon dioxide partial pressure. So, what is the respiratory mechanism? Is the depth and rate of breathing, which is controlled basically by the brain, and it controls the excretion of carbon dioxide. Carbon dioxide in solution form is acidic. Higher PaO2 causes acidosis, as we saw from the previous picture, or it neutralizes alkalosis. Lower partial pressure of carbon dioxide causes alkalosis, raises pH, or neutralizes acidosis. And what is the metabolic mechanism which is taking place by kidney? The main or the most important here is the bicarbonate or the alkaline component, and bicarbonate increases in response to high carbon dioxide concentration, and metabolic changes take days to develop. And what is the compensation? Compensation is the body's normal response to normalized pH by neutralizing the opposite acid-base mechanism. For example, if a pH is high because of respiratory alkalosis, that is low carbon dioxide concentration in the body, the alkaline reserve or the bicarbonate ions will decrease to neutralize the pH, hence bringing back to the less alkaline environment. In this case, the abnormal bicarbonate is not a metabolic problem, it is a metabolic solution to a respiratory problem. It is important to determine which is the cause and which is the effect. So, if you are going to treat the compensatory abnormality, you will only make the pH more complicatedly abnormal. And there are so far we know that there can be alkalosis or acidosis, or there can be compensated metabolic compensated respiratory problem or compensatory metabolic problem, and then there are combination disturbances. These combined disturbances occur when both partial pressure of carbon dioxide and bicarbonate concentration change the pH in the same direction. For example, low bicarbonate along with high carbon dioxide concentration both lead to acidosis. However, low carbon dioxide concentration and high bicarbonate lead to alkalosis. The combined disturbances are very rare, so most of the times the disturbances are simple or compensated. So we must know the normal ABG values, so that it is easy for us to interpret the abnormal ABG values. In case of ABG values, pH normal should be 7.35 to 7.45. For quick reference, 7.4. Carbon dioxide concentration 35 to 45 or 40. Bicarbonate 22 to 26 or 24. And partial pressure of oxygen 80 to 100 or 90. And oxygen saturation should be 94 to 100 or the median of 97. And then there are 8 steps for interpretation of ABGs. These include: number 1, first of all you have to determine whether it is acidosis or alkalosis. That you will decide from the pH value. And then number 2, evaluate the respiratory mechanism. Find out the which means that find out what is the situation of carbon dioxide concentration. Then evaluate the metabolic mechanism, that is find out whether bicarbonate is high or low. So here we go from step by step. First of all, you should memorize the normal values, which I showed you before. The pH 7.35 to 7.45, the carbon dioxide concentration 45 to 35, and bicarbonate 22 to 26. In step 2, you create this 3 by 3 table. In the center you write down normal, in left side acidosis, in right side alkalosis. This is known as Tic-Tac-Toe Grid. And then I discussed with you that first step is find out the pH, whether it is alkalosis or acidosis. So you write down the pH. If the pH is normal, write it in the center. However, if the pH is higher, you write it in the alkalosis center like this. And if the pH is lower, you write it in the acidosis section like this. And then determine the respiratory component, that is carbon dioxide concentration, whether it is in normal, acidosis or alkalosis center. If the pH is if the carbon dioxide concentration is raised, put it in the acidosis section. If it is normal range, put it in the central line. And if the carbon dioxide is below 35, put it in the alkalosis section, which is arterial pressure of carbon dioxide in case of below than 35. And after carbon dioxide, we discussed that you will now assess the metabolic component, that is bicarbonate ion. So this bicarbonate ion, if it is increased, that is above 26, put it in the alkalosis section. And if bicarbonate ion is decreased, less than 22, put it in the acidosis section. And if bicarbonate ion is normal, put it in the central section. And then you solve for the goal 1. You had moved the pH towards here in cases of acidosis and towards here in case of alkalosis. So first your goal is accomplished, that it is acidosis or alkalosis. The second step is you move the carbon dioxide concentration towards acidosis or towards alkalosis. Okay, so in case of respiratory, if the pH will be towards acidic, the carbon dioxide concentration will also be towards acidic. So this means the respiratory acidosis. And the bicarbonate will be in alkaline component to compensate for the respiratory acidosis. There will be compensatory mechanism of bicarbonate towards the alkalosis side. However, if the pH would be towards alkalosis side and carbon dioxide concentration would be towards the alkalosis side and the bicarbonate would be towards the acidosis side, then this will be respiratory alkalosis. So here you can see in case of metabolic alkalosis, the pH is towards alkalosis side and bicarbonate is also towards the alkalosis side. However, the carbon dioxide concentration is towards the acidosis side, so here respiratory compensation is taking place. And in case of metabolic alkalosis, this is the scenario: pH and bicarbonate both will be raised and carbon dioxide concentration will be low, which means the respiratory compensation is taking place in case of metabolic alkalosis. However, in case of a respiratory acidosis or respiratory alkalosis, metabolic compensation is taking place. ठीक है, respiratory में metabolic compensation होती है और metabolic में respiratory compensation होती है, और वो compensation opposite उसमें होती है. So goal number 3 is check out for the compensation. In case there is full compensation occur, then the pH will come towards normal. However, bicarbonate and carbon dioxide concentration both will be opposite. अगर बाइकार्बोनेट एसिडोसिस की साइड पर है तो कार्बन डाइऑक्साइड अल्कलोसिस की साइड पर होगी. ठीक है. और जो है अगर आपका पार्शली कंपनसेटेड होगी पीएच, ठीक है, देन द पीएच एंड बाइकार्बोनेट विल बी ऑन द अल्कलोसिस साइड एंड कार्बन डाइऑक्साइड विल बी ऑन एसिडोसिस साइड. ठीक है, इट मीन्स द पार्शियल कंपनसेशन. आई एम टॉकिंग अबाउट द मेटाबॉलिक partially compensated metabolic alkalosis. Alkalosis because the pH is increased. ठीक है. मेटाबॉलिक क्यों? क्योंकि कार्बन डाइऑक्साइड की निस्बत बाइकार्बोनेट आयंस इंक्रीज हुए हैं. अगर कार्बन डाइऑक्साइड डिक्रीज हुए होते तो फिर क्या होता? रेस्पिरेटरी अल्कलोसिस होता. अच्छा, एंड नाउ इफ देयर इज नो कंपनसेशन और अनकंपनसेटेड, then carbon dioxide will be in normal range. However, pH and bicarbonate will be increased. So interpret the result as follows. If in case it is fully compensated, if the pH is normal, and it is partially compensated if there is all the three components or all the three values are abnormal, and it is uncompensated if one component, that is either the respiratory or the metabolic, is normal and the other one is abnormal.